you have our commitment and our partnership to make significant progress together.
Welcome to the Global Health Catalyst series, and with me is Dr. James Metz. He's a radiation oncologist at Upenn, but I won't introduce him because I might do it injustice. So I'd like to, first of all, Dr. James, welcome to the series.
Thanks so much for having me. Really, really pleasure to be here.
It's a pleasure to have you here. And we just want to start by inviting you to please tell us about yourself, who you are, and what you do at Upenn.
Yeah, great. Thank you so much. Yeah, I'm chair of radiation oncology at the University of Pennsylvania and oversee our radiation oncology practices. We actually have 18 sites across the region. We push innovation, protons, other therapies out there. But one of the balancing acts I've learned through the years is that as we've pushed innovation, I've also found that's been very limited in general in who we can reach. And many, many more people in the world in general are just not accessing radiation. How do we expand radiation access globally to those that need it? In fact, a number of years ago, I attended the Aorta conference in Africa, and I was approached with my nurse there by some nurses asking for help in regards to education, as they had changed from an OBGYN and infectious disease hospital to a cancer hospital, but really didn't have educational background. And I learned a lot through that process by being invited in and helping develop programs of need, and saw just the impact of that, of bringing education to a region. So it's always important, the equipment and the other things, but the education and the people are so primary, and there's such a need for that globally. And that kind of gave me a passion for getting involved with this. And fortunately, at the same time, in my department, I had some other very passionate people in global health that were looking to develop programs globally. And Serby Grover, who's in Botswana, has established a program there with the Botswana Upenn initiative in regards to developing multidisciplinary programs for cancer care and policies and procedures and how we institute that. And that's going really well. And we're developing a pipeline of people from physicians to residents to medical students that all want to get through continue this process, because I really believe in sustainability and how we can build programs that are sustainable and keep bringing in younger generations into this. And in parallel to that, Steve Avery in our department in physics has done an absolutely amazing job in regards to reaching out and developing collaborations globally for physics training and helping bring up the next generation of physics, again, with this idea of training and getting people in place and having them sustainable in a region. So I'm really proud of the way the people in my department have engaged in global health. We've hired initial people in this. And again, I come back to sustainability and funding. I'll tell you one story real quick, if that's okay.
Absolutely.
I really learned a lot by this original program that we did with nurses. It was actually in Tanzania, in Dar es Salaam, that we created this nursing training program, and it included computer-based training and on-site training, hands-on training, all of that. And we were able to translate that into what we were doing at the University of Pennsylvania for novel, unique, innovative therapies like protons. So I actually learned in delivering care in an area that needed lots of resources and how to apply those things in a very high resource setting, that we actually developed a financial model that allows us to make revenue. And now we pump that back into our global health programs, which has been a unique way of thinking about it, that we've kind of developed new innovative programs that are funding our ability to do global health programs. So we kind of think outside the box, but I just am amazed at what we've learned by our global relationships and what we've been able to apply to actually develop revenue streams too.
It's exciting. Oh, sorry. Yeah, it's exciting to hear you mention a few, I won't call them terminologies, but the issues that are key in this global health work. One was sustainability, Then you talked about the innovative ways, and of course, collaborations. And this being the Global Health Catalyst Summit, it's bringing together all these different collaborators. And before I even forget, thank you for everything that you did for Tanzania and for whatever you're doing in Netherlands, Africa. I'm from Africa, Uganda to be specific, but any work that is being done to support our people back there, it's really, really appreciated because of the very fragile infrastructure, healthcare infrastructure. So back to the Global Health Catalyst, what are some of the things that you look forward to as one faculty at Upenn, you're the hosts, and two, as a professor in radiation oncology?
Yeah, for me, it's so important at this conference to develop relationships. And we have lectures, we have talks. I find it's the side conversations that become so meaningful and end up being enduring after this. And that's what I really love to see, is those side conversations and relationships that are built, because this is all built upon relationships, right? To make this be successful and sustainable, and bringing new ideas, bringing the next generation in. Getting them excited about this is all so important. I see this being a catalyst, the true catalyst for this, and how we partner with academics, with NGOs, with industry, and bring things novelly together are really, really super important for the future. I see this all happening at this conference, which is so important.
Absolutely. No, I'm excited. This is going to be my, I think, 5th year with the conference, and maybe I'm exaggerating, 4th year. But it's always very humbling to hear all the different things, that the possibilities of what could happen when people come together, when people collaborate. And so for Upenn, this is the first year that you're hosting. What has that been like for the institution? And going forward, what do you want to see coming out as a result of this Global Health Catalyst Summit?
Well, for me personally, it's really important. Steve Avery came to me and said, we really want to host this at Penn. And I was very supportive. I think looking at the work that's going on here at Penn and bringing everybody here to our home site is really exciting for us, and to host this and see what comes out of it for the future. So, and I think it puts a stamp on how important this is to our institution and our department going forward. We want to see this success going forward. And I can't thank Steve Avery enough for all the work he's done in this, and thought he's put in this, and the team around him have really done a great job. So I'm incredibly excited to host it here going forward. And I go back to those, what I said earlier about, I'm thinking long-term about sustainability of our program. And this is a piece of that, showing the importance, getting our residents engaged, getting our younger generation engaged, because I really want to have these levels through the department, from very experienced people to very junior people, and seeing the pathway for being involved in global health, and coming up with novel funding mechanisms of how we do that, because that's always key, right, for sustainability, that we need to come up with these novel mechanisms. Some of these are partnerships. There's grants, there's industry grants, there's even developments of technology that can be developed in the developing world, which is critical. I'll give you another example of that, which a number of years ago, around 2014, I was contacted by one of the major vendors in radiation oncology, was Varian. Varian saw the need that we need radiation in the developing world, and there was a huge gap. But the machines that were available at that time were very expensive, needed lots of shielding, very technical, high power requirements, high water requirements. And they wanted to develop a new novel machine that was much easier to utilize, less costly, less shielding. And we partnered with them on that. And as I did all this, I said, you know what? All these things we're working on for the developing world are critical for us. And so again, I come back to everything we're doing to try to extend things and extend radiation are just as critical here where I am, and my 18 facilities are, as they are in Uganda or South Africa or Tanzania. So it really is a world that is so, we think about it being separate. It's not. It all comes together. We all need the same things, ultimately, is giving high quality care to patients in a reproducible way, having trained people and good equipment. That's what we need across the board.
You've articulately explained the whole concept of global health is local health and local health is global health.
Exactly.
That's exactly what we mean. And with that, is there anything else you'd like our viewers to know about the upcoming summit before we wrap this up? Of course, I'm looking forward to opportunities to actually engaging more in the conversations with you at the summit and beyond, just to track the whole process of all the conversations that are happening. And you said that we're going to be it's important to make those relationships. It reminds me, in diplomacy, they say that the decisions are not made in the plenary.
Yes.
The decisions are made in the side rooms and in the corridors and then during break time.
Absolutely. It's so important. And that's what I really look forward to at the summit. And I look forward to your viewers attending at the University of Pennsylvania and being engaged with this and forming those new friendships and relationships, which will really drive this for the future. So thank you so much.
Absolutely. I look forward to meeting you in person. But for now, thank you really for making time to speak with us.
Great. Thank you so much.
And to our viewers, thank you for watching this series. Look out for more videos to learn more about the Global Health Catalyst. For now, thanks for watching. Till next time.